President Barack Obama's health care reform law, the Affordable Care Law, gives states across the nation gives them big decisions to make. One of them is how to set up a health insurance exchange. It's a decision Governor Walker announced today. News 8's Carrie Vick joins us with the details.
Well, Lisa, the Health Insurance Exchange is basically an online marketplace for individuals and small businesses to shop for health insurance. Governor Walker had a choice between a state-run exchange, a partnership between the federal government and the state, or a federal exchange. Today, he announced Wisconsin will have a federal exchange. On the surface, Governor Walker says choosing a state-run health insurance exchange seems like a good idea.
Instinctively, on any issue, I, like probably most governors across the country, Republican and Democrat alike, when given a choice, would prefer state-run over anything over the federal government.
But take a closer look at the options, and Walker says the state-run exchange may not be as good as it sounds.
They don't give the kind of true flexibility that would be required to provide something unique for our state and the state of Wisconsin.
Health experts say while the state-run exchange does give some options, in the long run the federal government still has the final say.
There's a little flexibility the state would have in terms of the exchange. However, and with the federal exchange, they put pretty significant restrictions in on what the states can and cannot do. So yes, there is a little bit more flexibility on the state side, but they're pretty much stuck with what the federal government has put in for rules.
It's the lack of flexibility combined with the cost to taxpayers which led Walker to announce that Wisconsin would let the federal government set up its health exchange.
A state-run exchange might expose the taxpayers of Wisconsin, not just as federal taxpayers, but as individual state taxpayers, to greater liability, to greater cost in the future. And so that's ultimately what made our decision.
Walker's office says funding from the federal government for a state exchange would only last through 2014. And while avoiding extra costs for the state is the driving motivation for Walker's decision, it may not completely save the taxpayers from having to shoulder some extra expenses.
There's no guarantee in any of it. It just makes it one step removed and one step more difficult to pass those costs on.
The governor of Iowa announced the state will opt for a state-run exchange, but may defer to a federally run exchange if enough questions aren't answered. Minnesota is also planning on creating its own exchange.
Thank you, Carrie. The health insurance exchanges won't go into effect until January 2014, when all Americans will be required to have health insurance coverage.